The flagpole and serratus punch is a really great way of getting kind of familiar with the relationship of your rotator cuff and your shoulder blade muscles in controlling where your humerus sits in the socket. Imperative for things like push-ups and pull-ups and other functional tasks, but for general movement, being able to lift your arm up overhead, knowing what your ball is doing in the ball and socket joint of your humerus is important to know if you're hiking the shoulder or moving out of any ideal pattern. Okay, so being able to kind of know what's my shoulder doing in the socket. Is it rotating? Is it moving? Is it elevating? Is it lowering? The serratus punch and flagpole is a great way to know how are my mechanics. How am I getting my arm up in the air? Is it causing that impingement? Is it causing some kind of a poor stress to the rotator cuff muscles or to my bicep tendon or some of those other structures that we're typically going to be seeing in therapy for during our lifts or during just our general daily activities. So to do this exercise, you're laying on your back, and I like to just have my patients try and feel, when they feel like their shoulder's at its like baseline or most neutral position. So to do that, you just bring your shoulder all the way forward, bring your shoulder all the way back, and do that a few times. As you do, you'll notice that there's a stress to kind of being all the way forward. There's also a stress to kind of all being all the way in the back. And somewhere in the middle of those two, there's going to feel like there's a place where it just kind of feels rested and comfortable and not really trying to be in a specific position, if that makes sense. It just feels settled or more neutral. That position is going to be the position we want to try and stabilize within. So we start on our back. We can hold a light weight. It can be anything from a can of soup to 5-10 pounds, depending on what your therapist recommends or what your strength level is or what your comfort level is. And you're holding that position, and I'm trying to maintain the position of my humerus inside that socket. So as I accept any kind of weight or as I hold my position there for any period of time, 5-10 seconds or so, do I feel the ball of my humerus sliding back at all in the joint? It's a subtle thing. It does take some feel and some practice, but what you can do again is practice bringing it back, bringing it forward, and just recognizing when you feel those subtle shifts in your shoulder position and learning how to not do that. This is the same kind of concept we use for core exercises and hip stabilization exercises, but now we're just relating this to our shoulder joint specifically, and do we recognize these subtle cues that are telling us that we're not in an ideal position? Not being in an ideal position, I equate this to if I have my shoulder all the way back or have my shoulder all the way forward, it's kind of like if I'm on my heels in terms of my trunk position. If I'm on my heels and someone tries to run past me or run at me, my ability to react isn't as good as if I'm grounded with my knees bent, body weight kind of forward over those legs so that I'm prepared to move, kind of thinking of your defensive position in most sports. This is the shoulder's equivalent to that kind of positioning and that kind of analogy, is being in the center of that socket. So once I've established where the center of that socket is, now I'm just going to hold that position. That would be the flagpole. And can I hold that for a prolonged period of time, depending on your goals? Many of my military patients need to be able to hold planks, so I'll have them hold this for multiple minutes, just being able to stabilize. But if you're just trying to build up endurance for most daily activities, hold this for a minute or two, and that's going to be a good, mind-body connection kind of an exercise. It doesn't have to be held much longer than that. You can slowly add more and more weight as you feel comfortable. You certainly don't have to go high in weights, but absolutely can. This is an exercise that can handle pretty heavy loads to prepare you for heavier tasks, like, again, push-ups being one of the key ones. As I want to increase more activation of my serratus, which is one of my power move muscles of my shoulder blade, what I would then do is, from that baseline position of the flagpole exercise, press my shoulder forward. Now I'm trying to visualize still that humerus staying relatively close to the center of my socket, so my shoulder blade is now the mover. I'm not really trying to change my shoulder position. This is also kind of one of those subtle things you have to kind of feel, and it sometimes helps with your therapist to kind of find this. But bringing that shoulder blade forward around my rib cage, as I do that, my humerus is going to try to come across my face. But again, if I'm keeping that shoulder center socket, I should be able to move that shoulder blade forward and keep my shoulder right in the middle of that socket, so my shoulder should actually still be pointing vertical, and my arm should not come across my face as I bring the shoulder blade forward. If it does, that kind of tells us that we're kind of pressing and compressing that shoulder joint in the socket and kind of isometrically moving and not having pure stabilization and opening and closing rotation of that humeral head. So it's just that forward motion of the shoulder blade around the rib cage, and then coming back to baseline, not coming back all the way to the floor and pulling my shoulder blade back, because that's again going to take me out of that ideal pocket of the shoulder. It's coming back to that baseline and then punching forward again with that shoulder blade and then coming back. Now, this is not really as much of it's an endurance exercise, but some people do feel better with this one to do reps and sets. So depending on the weight, depending on your comfort level, a lower weight, maybe higher reps, 12, 15 repetitions, and you do a couple sets. If you're going into higher weights to try and build up towards bigger tasks, then heavier weights into the 30s and 40s and 50s of pounds, and now you're repping this like 6 or 8 reps to build up strength. Depends on your goals, but it's a great exercise no matter what they are, trying to work on building that serratus stability and again that relationship of where is my humerus in space.